So somebody wanted to know if you can just have pupil only in third nerve palsy. And the short answer is no. And the reason is the third nerve pupil pathway, it would be extremely difficult to just get the pupil only from a third nerve palsy. Not only is the arrangement of the pupil fiber topographically on the outside of the nerve in the subarachnoid space, but it would be very, very difficult to only have the pupil because the nerve is so small. So anything pressing on the nerve is going to involve the pupil first, but it's going to hit the lid and the motor fibers as well. So the short answer is no, but it's really important that you make sure that there's no ptosis and no motility deficit in any patient who has anisocoria. Because when you have a dilated pupil or a smaller pupil, a myotic pupil, the benign causes of that don't actually cause deficits in ptosis or motility. So all three things are linked together by the third nerve: the pupil, the lid, and the motility. And so if you have an abnormality in any one of these three sections, you must test the integrity of the other two. And if you have 2 out of the 3 out, that's really bad. And if you have 3 out of 3 out, a pupil, ptosis, and motility, that's very, very bad. So anybody who has diplopia, so example would be exotropia, we need to check the lid and the pupil. If it's just exotropia alone, that's much more likely to be an INO or a pseudo-INO from myasthenia gravis or a decompensated pre-existing childhood exotropia than that being a third nerve palsy when you don't have any other motility deficit, you have no ptosis, and you have no pupil involvement. Likewise, when you just have ptosis, it's extremely unlikely that ptosis alone would be a third nerve palsy. That's way more likely to be the muscle, like the levator. And so when you have ptosis, before you blame it on the benign levator dehiscence problem, you need to make sure the motility is full and there's no pupil involvement. You also need to make sure it's not a Horner syndrome by checking the ptosis and the pupil. That'd be a smaller pupil. And so pupil only from third nerve palsy would be extremely unlikely. You should be looking for Addy's tonic pupil, something wrong with the iris on the slit lamp examination, or a pharmacologic blockade of this pupil. These are going to be way more likely causes for the pupil only to be dilated than invoking third nerve palsy. But please make sure to check no ptosis and no motility deficit before you say it's pupil only. And then pharmacologic testing can differentiate these entities. Addy's tonic pupil will show super sensitivity to low-dose pilocarpine, 0.1%. Pharmacologically blocked pupils from pharmacologic mydriasis from anti-acetylcholine agents will be blocking the junction, and therefore pilo 1% will not constrict that pupil. So you need to know a little bit about third nerve palsy, but really anybody that has pupil, ptosis, lid, or motility, you must check the other two and ensure that they're normal.